Welcome to the Sleep is a Skill podcast. My name is Molly McLaughlin, and I own a company that optimizes sleep through technology, accountability, and behavioral change. Each week, I'll be interviewing world-class experts ranging from doctors, innovators, and thought leaders to give actionable tips and strategies that you can implement to become a more skillful sleeper. Let's jump into your dose of practical sleep training. Welcome to the Sleep is a Skill podcast. Today's topic is on cannabis and CBD. And oh my goodness, the number of questions that I've gotten around this area for sleep and how to improve quality of sleep, anxiety, pain, you name it, it has come up. So I'm really excited to have today's expert who actually wrote the book on cannabis and CBD for health and wellness. And of course, in this conversation as it relates to sleep. So a little bit about our guest. Dr. June Chin is an advocate for better understanding of the science and medicine of cannabis. Dr. Chin and her team of physicians consult with patients all over the world. They have been integrating medical cannabis since 2001. Her work has been featured in Forbes, LA Times, CNN, Good Morning America, among others. The book she co-authored, Cannabis and CBD for Health and Wellness, was published in June 2019. And basically a case study from the book that I thought was interesting, featured a quote, right? And it said, "That first morning when I realized I had slept an uninterrupted 8 hours without pain, I cried with relief. Then I thought, why don't more people know about this?" And I wanted just to feature that because, one, I think so many of us can relate to those moments that are maybe for a lot of us few and far between when we've gotten incredible sleep and the difference that that can make. And so I'm really excited to dive in to understand more about our expert's relationship to cannabis, how it actually made a huge difference in her life and her management of her pain and chronic pain that she had for many, many years, and how that in turn had her dedicate her whole life to this area of study. Let's dive in. And welcome to the Sleep is a Skill podcast. My guest today, Dr. June Chin. I'm so excited to have on to share with us more about this world of cannabis and CBD as it relates to sleep. So thank you so much for taking the time.
Thanks so much, Molly. I'm so excited to talk to you today.
Awesome. All right. Well, we're going to dive right in because I know you're just a wealth of knowledge and we want to be able to, really get in deep on what there is to offer in this area of how people can utilize this to help improve their sleep. So I'd love to hear just your story as to how you got into this arena and why you're passionate about this topic.
Oh, absolutely. For me, I'm a chronic pain survivor. So when I was a teenager, I was diagnosed with an autoimmune disease of the spine called ankylosing spondylitis, which is a big complicated word, or AS for short. But what essentially happens is your spine fuses together, so you lose all mobility. So as a teenager, you're supposed to be cartwheeling across your living room floor and doing backflips, but I couldn't even stand to do the dishes. I couldn't sit for more than 15 minutes without excruciating pain. And really, I cycled through all of the conventional medicine that you can think of, your anti-inflammatories, muscle relaxants, epidurals. I did alternative medicine from acupuncture to Ayurvedic to hypnosis, and there was really nothing to give me long-lasting relief. I would wear a back brace all the time and pull it as tight as I could. So by the time I got to medical school, studying to be a physician, I was in San Francisco at the time, shortly after they legalized medical cannabis. And I was doing rounds. I had my back brace on like I normally do. And one of my attendings pulled me aside and said, "What's going on? Why are you wearing that, first of all? And you're clearly in pain." So I explained to him I had AS and that I was just totally, disheartened because I couldn't find any answers. I'm studying to be a physician. I'm surrounded by great medical minds, hundreds of doctors at my disposal, but no one could give me any answers. And he says, "Okay, well, I'm going to offer you something a little unconventional." And he pulled me aside and gave me marijuana. He gave me this little tincture bottle. And he said, "This is marijuana. My HIV and AIDS patients use it. Don't freak out, but it will work for your pain. Just take it at night before you go to bed." And I sat with that with that tincture on my dresser for several weeks because I really was torn. Here I was studying to be a physician. I was a med student, and my mentor was offering me marijuana. So,
Right.
and so I tried it, and over the weekend, by Monday, I knew it was working. So I
Wow.
dedicated my career on figuring out all that I could about this plant medicine. Why did it work? Why weren't we learning it in medical school? And why weren't we offering it to our patients with chronic pain?
Oh my God,
I know.
this is so good. And thank you so much because that the visual to really pull us into your experience and how this is clearly it's not just something that they've got some studies on. This has really made a difference in your life. And then, what you've done to transform this area and really become a pioneer in this industry. So from that place, you've touched on a number of things that I see with a lot of my clients coming in that are dealing with chronic pain and how that's impacting their sleep and all the things that they've tried and, have many times failed at how to manage this pain. So I'm wondering if you could start at the beginning to kind of, just break this down for us because when we talk about marijuana, it's such a big umbrella. So I'm wondering if you could give us kind of the ABCs on what are some of the things that people might want to look to based on different things that they might be dealing with and how they navigate this new world of pain relief.
Sure, sure. So insomnia is actually one of the number one things that patients come
Yes.
in and see me for. So,
So
just
perfect.
this week, at least a dozen patients a day. I'm doing telehealth right now, during COVID, but a dozen patients a day. The number one complaint is I can't sleep and I can't get to sleep. I can't stay asleep.
Yes.
The root of the problem usually stems from either chronic pain, sometimes anxiety, sometimes depression. So they're really, I think sleep can come from a lot of different sources. So what's interesting about cannabis, the cannabis plant, is that especially with all the research that's happened over the last few decades, is you don't have to utilize the cannabis plant and the end result doesn't have to be euphoria or getting high, sedation, feeling out of control. There are parts of the plant that can relax the nervous system, but still make you laser focused and productive. And that's CBD. And CBD is the part of the plant that doesn't make you high, but that does give you a grounded feeling. My patients will say, I feel like I did yoga. I'm just much more relaxed and I feel more comfortable in my skin. On the other side of cannabis medicine, there's THC. THC is the other player, and THC is known to be very relaxing, put you in a dream state. If you've used cannabis recreationally, there's a lot of THC in a lot of recreational products. You might take it, at the end of a long week, at the end of the evening when you're trying to wind down because it's relaxing and sedating, and it does produce a euphoria, a high. And then there's in between. There's things in between, different parts of the cannabis plant, other cannabinoids, other molecules of the cannabis plant that can work on inflammation, seizures. It can work for my Parkinson's patients, nerve pain. So cannabis medicine is really quite amazing, and it's come a long way.
Wow, so interesting. So I wonder if we could begin with, CBD. We get so many questions about that for people that are just, strictly just want help falling asleep. They don't want to go to necessarily prescription drugs, but the idea of CBD is interesting to them, but they have a lot of questions around it. I wonder if you could help demystify and also just share about sourcing on like where we go to get to have that knowingness that we're getting what we're buying.
Sure, sure. So CBD, again, the part of the cannabis plant that does not make you feel high, but it helps you relax and reduce anxiety through the neurotransmitter GABA. And GABA is a natural brain chemical, and it basically tells your body you are safe. You're not
Yeah.
running from a bear, you're okay. It takes that fight or flight response away. And you can take CBD without worrying about getting high. But the problem, as you mentioned, is sourcing a really good, reputable product. Because CBD is not regulated by the FDA, it's really up to the consumer to make sure that their CBD product is third-party tested. So third-party testing means that there's a outside lab that's testing the company's product and looking for mold, pesticides, heavy metals, making sure that the potency is correct. So when you're looking at the back of the label of your CBD product, it's like looking at the back of a food label, right? You're looking at
Mm.
sugar content, carb content. So when you're looking at the back of a CBD supplement, you're looking at, well, how much CBD is there? Has it been tested for heavy metals? Is there purity? And looking at the website, looking at the company transparency. So those are all very important things to look for that you have to do your own homework on.
Mm. Do you have because and we'll get to more too about all the things that you offer on your website, or are there sources that you do recommend, or do you just have people kind of navigate that from a certain kind of select group of as far as the third party testing?
Absolutely. I do have recommended products on my website. And also
Okay.
when you go to those websites, good products, good companies will have their third-party testing results actually on their own website. So when you click on a product, you should be able to see that lab test as well.
Okay, so that's kind of another rule of thumb, ensuring that you see that. Okay, got that. And so how do people then begin to navigate? Because then we've talked about the spectrum where there's CBD, and then on the other end of the spectrum is THC, and then we find that there's all these different ratios. So maybe we can first begin with breaking down THC and its relationship to sleep and pain, and then we can understand the ratios a bit more.
Sure. So THC is great for acute pain. It's a natural muscle relaxant, and it can actually help you fall asleep faster. So the first question I ask when patients come in is, are you having trouble falling asleep or staying asleep? If they
Mm.
tell me I can't get to sleep, like I can't put my head on the pillow, tossing and turning, then I will recommend a little bit of THC. Of course, I'm looking at the whole patient medical history, but when you're taking a little bit of THC, microdosing, it can help you fall into sleep. And then it depends the ratio of CBD to THC. So the balance of how much CBD there is compared to THC depends on the patient's age. Am I speaking with an elderly, or am I speaking with someone that is young and active and exercising and does not have high blood pressure, cholesterol, metabolic syndrome? So ratios differ depending on what the patient's medical needs are.
Mm. So, got that. And just to follow up on that part, so because it sounds like you really help provide people with a lot of guidance on the selection process, is that something you do recommend for people, that they kind of create a relationship with their doctor on kind of dosing what they are trying in the realm of the cannabis to CBD, if they're going to start endeavoring into that?
Of course, talking to a health practitioner is wonderful, especially if you're on other medications.
Yeah.
Some of my patients are already taking benzos, Xanax or
Yes.
Klonopin, or they're taking other antidepressants because cannabis, CBD, and THC works on serotonin receptors as well. So it might affect the way your other medication works for you. Same thing with like Cymbalta or Seroquel. So I make sure I have that conversation with my patients. Unfortunately, it's hard to find a doctor that understands both cannabis
Yeah.
medicine and
Uh-huh.
conventional medicine. So, the wonderful thing is there are nurses that can help, holistic nurses, naturopaths, chiropractors, health coaches. I mean, this is plant medicine at the end of the day. So you can work with it quite safely. And it's always safe to say, if you want to work with CBD first, that way you don't have to worry about feeling altered in any way.
Yeah.
And then slowly increasing or microdosing the THC, keeping a journal, just like you would, during sleep habits, trying to keep that sleep hygiene, you would keep that journal along with the cannabis usage.
Got that. And yeah, I'll have a lot of clients that will come in similar to you, that will be speaking of, years of, kind of benzodiazepine use, and are curious about ways in which that they can start to, endeavor with kind of the wean off process. And again, of course, they're always doing that, asterisk, with medical supervision and what have you. And I'm just wondering if you've been able to see success stories of people being able to kind of shift from the use of benzodiazepines to, or hypnotics, over to cannabis and CBD.
Yeah, that's very, very common. I think
Yeah.
people that are trying to wean themselves off benzos or antidepressants, and many of it is because they were on this treatment for a long term, but maybe their life situation has changed and they don't feel like they need the prescription anymore. But
Right.
at the same time, the biochemistry is so profound, especially the brain biochemistry, that the body does become dependent on it, and the withdrawals are quite severe.
Mm-hmm.
So telling patients to get off medication is not that easy. I actually have patients go to a compounding pharmacy, and sometimes those Klonopin doses, especially Klonopin or sometimes like Seroquel, Cymbalta,
Mm-hmm.
I'm compounding, milligram by half a
Mm.
milligram by drop because it is that
Wow.
sensitive. Patients feel crazy. They feel like, and
Yes.
this feeling is actually the withdrawals. It's not that they need the medication, it's actually the withdrawals. And the cannabis can help you with the withdrawals.
Oh, wow. What a blessing. Yeah. Because some of those withdrawals are just, oh, God. And then so many people don't embark on that process. They want to, there's the yearning, but the fear of those withdrawals. So to know that there could be this as that option can really make a difference. It's amazing.
Absolutely, absolutely. And then for women, we are more sensitive to cannabis compared to our male counterparts.
That's a really good point. Say more about that. What is that breakdown, and what do you see with that? Are a lot of your clients coming through a lot of women that you're speaking to on this topic, or do you also work with men?
I work with males and females, but I
Sure.
do see a majority of women in my practice. And
Yeah.
I always talk to them about the estrogen relationship with THC because estrogen and THC are very interrelated. Your cycle can actually influence your high. So,
Mm.
and this has been proven through Washington State University's researchers that women experience the most effects from the THC component of the cannabis when their estrogen is peaked and then beginning to fall. So this happens like a day or two before you ovulate. So I will actually have my patients with insomnia, depending on their age and how their hormones are, I would actually change the dose depending on the day of the month, depending on their cycle. So
Mm.
some women say, oh my God, close to my period, I just can't sleep at all. I feel terrible. And it's not in their head. It's actually hormonal. And they might need a little bit more cannabis at that time. They're not building a tolerance, but they do need more cannabinoids. And then I'll back off of it, when they're on day 1, 2, or 3. So we actually play with it. It's a dynamic process.
Oh, wow. It's so interesting. I actually just had Aliza Vitti from Flow Living, who created this company, Flow Living, and this whole cycle syncing app, for women
Mm.
to be able to cycle sync their activities, their type of workouts, their, maybe supplements, different things based on where they are in their cycle. Thinking we should connect you guys on adding this layer into the cycle syncing, because certainly we see a lot of that. So a lot of my clients will be wearing different sleep tech, and it's just, so apparent for my women that are childbearing years, where the ups and downs of the infradian rhythm, where they'll see often, post once they get their period, then with the shift in progesterone, that suddenly that aptitude or the ability for them to sleep can often get can be aided during that period, but then a whole other procedure goes on leading up to their period. So providing that information is so helpful. So thank you for that. And with this, it can occur for so many people is just really confusing, because now we also have ratios in the mix. And do you have any other rules of thumb for when people start wanting to, so maybe they've tried CBD and they're looking to, maybe go deeper? What are some rules of thumbs for the different types of ratios that we're delving into in the area of sleep?
Sure. So I always split it into 3 parts. So you can have a CBD dominant ratio where it's mostly CBD. Then you could have a hybrid where it's 50-50, 50% CBD, 50% THC. And for the most part, taking that during the day is still okay. Most patients don't feel cognitive effects from the 50-50 ratio. And then when you get higher than that and you're basically bringing down the CBD but turning this THC up a little bit, that's when you'll start to feel that relaxation component and that sedation. Now, there's a caveat with that. Some of my patients that have ADHD,
Mm.
trouble focusing, maybe they have that Ferrari brain, but bicycle pedals for brakes. They actually do well with a little more THC, and it does not sedate them.
Wow.
Yes, it actually helps focus and it just kind of drowns out that ambient noise, that peripheral distraction. And they find that it helps them relax because it drowns out that distraction, but it helps them focus and be more productive.
So interesting. Okay. And the dosing for some of this stuff. So say if people are starting out then at, kind of the first step with CBD, how do they begin to navigate dosing? Do you find that it's kind of that you have to test with each person, or is there a rule of thumb that you recommend?
You always start low and you
Yes.
always start slow. That's just the rule of thumb because you don't want to be uncomfortable. If you're nervous about trying cannabis for sleeping, if you're going to use a THC dominant formula and you're nervous, just make sure that you have a partner, or a friend that you can sort of turn to and say, hey, listen, I'm going to begin this. If I can just check in with you while I'm doing this, it would really help. And then start really low. They have little micro mints. The West Coast has a beautiful array of different cannabis products compared to the East Coast, but there's a lot of microdose mints that you can take, sublingual tinctures, which are a liquid formulation of cannabis, and you can really dial the dose down very, very low and just add a drop by drop or half tablet by half tablet and increase it every 3 days. So let's say, for example, you would try 1 milligram of THC the first night to help you get to sleep. And then you would use a CBD product at the same time so that you stay asleep, so that you're sleeping through the night. If that THC 1 milligram didn't work for you and you couldn't get to sleep, I would say just hang in there, try it again that second and third night, because maybe your body just needs to adjust and get used to it. And then if it still doesn't work, then you would add, 0.5 milligrams, another half a milligram to that, and do that for 3 nights. You should be able to get to sleep easily. And then if you wake up in the middle of the night, use the restroom, you should be able to fall back asleep easily as well.
Mm. And do you have a recommended way of administering that? So do you prefer that people start with the tinctures or, vaping or all these different options, capsules, patches, creams, or is it kind of just personal preference?
That's an excellent question. It depends on what your end goal is. So if you need to get to sleep quickly and you don't have time to waste, an inhaled version will work within 30 seconds to 10 minutes through a vape form. Sometimes they have inhalers that look like asthma, albuterol inhalers that you can squeeze. Sometimes fast acting sprays that'll work. If you're saying, I can get to sleep, I just wake up at 2 a.m., 3 a.m., and 4 a.m., that's
Right.
when you'll try a capsule. So you try a capsule because the capsule kicks in about an hour or 2 hours later.
That's such a good point. Interesting. Okay. So really I can also see why it makes so much sense to work with someone like you that can help guide the person and because I do see that I'll have a number of clients that they tried once or twice CBD, THC, but it didn't work out for them. So it's kind of the whole idea is thrown out. And yet I think you're pointing to as well that there's a lot of different ways to look at this and different approaches. So I'm wondering if you could also help us understand, you hear a lot of these different words like vocabulary when you're kind of in the shopping for this. So, there's topicals, edibles, flowers, concentrates, tincture, all of these things. If you could, help us understand and break down some of those and through the lens of looking to improve our sleep.
Sure. So let's start with the inhaled version. So you're using a vape pen, an oil that goes into a vaporizer, or you can use a flower that goes into a vaporizer. Those inhaled forms are 90% absorbed straight into the bloodstream. So your brain receptors are like a sponge, and that's why it acts so quickly. So if you need to get to sleep right away, that's what you'll use. There's tinctures, which is the second tier. Tinctures are great because you can control the dosing. It comes in a little dropper bottle. It looks like baby Tylenol or, sort of children's liquid Advil. And then it comes with a little syringe that has measured dosing. Wonderful thing about that, especially for very sensitive patients or patients that are newer to cannabis, then you can measure the dose. If you could, again, drop by drop, if you say 0.1 milligrams, 0.2, 0.3, so you can gradually increase it safely. Then there are edibles. Edibles come in the form of gummies and chocolates. which I don't love because it's
Mm,
very difficult to measure potency. It's
yeah.
much easier
Yeah.
in a capsule where it says 5 milligram capsule,
Yes.
or a tablet that you can break in half. Those are solutions, again, when you're looking for something to kick in much later, almost like an extended release. And sometimes patients will use both. They'll use a vape pen in the beginning of the night to get to sleep, and then they'll follow it. They'll take the capsule right after that. And that way they get to sleep, but then they're also not waking up at 2, 3, at 4 a.m.
Got that. Okay. And what about for some of these creams and balms? So I'll have different clients that have arthritis or back pain or knee pain or, all these things that might be keeping them awake. Are those things that they want to do regularly, or do you suggest more taking something internally?
If you're really having a hard time sleeping, and insomnia is just so prevalent these days, topicals are just really for localized relief of musculoskeletal pain. So if it is musculoskeletal pain that's getting in the way, the topical will wear off in a couple of hours. But if you are looking as an anti-inflammatory, let's say you do need a topical because your low back hurts and that's what's keeping you awake, you might want to consider taking a CBD dose, because the CBD is an anti-inflammatory and an anti-pain, and then using a topical, I mean, not just before bed, but you could use it throughout the day as well.
So good. Okay. And then I'm wondering if you could help us understand too, because now with CBD, this is one strain that we're understanding. And then there's different elements that people are looking at, CBG, all these different things. I wonder if you could help us understand a bit more about these new areas of the plan, or if there's just too little to know about that right now without enough studies.
It's still very early. Everything is in an infancy in terms of what's called minor cannabinoids. So the other cannabinoids besides CBD and THC are things like CBG, CBN. CBN is sedating. CBN is a byproduct of THC. And a lot of patients love CBN because it doesn't give them the euphoria, but it does give them the sedation. So
Mm.
it really depends. Some patients don't like feeling the euphoria, and some patients just want help sleeping, so they'll use a CBN formula. CBG, early research has been showing that it's very good for irritable bowel patients with, gastrointestinal inflammation. Also very good for inflammation in general, musculoskeletal, ligamentous inflammation as well.
So interesting. Great. So, do you find that part of the challenge of going deeper in this is are you seeing enough studies being funded in order for us to all learn more about this and how it can impact sleep? Or has that been an ongoing challenge, or where are things at as far as scientifically?
Scientifically, it's been a challenge within the United States because it's still federally regulated. So when anything is federally regulated, it's very hard to study it and get funding. If you look internationally, there's been a lot of studies on the different cannabinoids. Luckily, a lot's changed this last couple of years. I mean, here
Yeah.
on the East Coast, Montefiore, Albert Einstein, NYU Langone have combined received over $10 million, even through the Department of Justice, to study CBG, CBD on autism patients, on epilepsy patients. So it's definitely on the up and up.
So great. Awesome. And then to that point, one of the last things I was wondering on, certain people that are dealing with state by state issues, do you have rules of thumb of people that are looking to be able to get more and more access to legalized marijuana, and what the procedure is if people have been kind of, considering, kind of getting a card, what that looks like, that process?
Absolutely. They should. Every state, unfortunately, it's like its own island. So
Yeah,
there's
true.
different laws, different regulations, different qualifications for different patients. I always have patients look at the Department of Health through their state, and through the Department of Health, if they have a medical cannabis program. If they do, there's usually a list of recommended regulated dispensaries. So those that are regulated by the state and they oversee, the testing. And then also a list of physicians, nurse practitioners that can give you a medical card.
Got that. Okay. So, I'm sure anyone listening to you, you've piqued their interest. So, how can people learn more about you? I know you've, just written one of the handbooks on how to understand and navigate this world of cannabis and CBD, particularly for health and wellness. And of course, in the realm of sleep, very much a big topic here. So, what are some of the ways that people can make sure that they're in this conversation with you?
Sure, sure. My website is drjunechin.com. I am also on Instagram. My book is Cannabis and CBD for Health and Wellness. So it's a really great overview of cannabis medicine, CBD, even just plant medicine in general. So whether or not you may or may not use cannabis, but if you're interested in a more holistic health and healing, it's a really great primer, and it explains how plant medicine plays a role with integrating with conventional medicine.
So awesome. Well, I really appreciate you taking the time. I know you're on the West Coast, so it's getting late for you. So we want to make sure you get your sleep. But really, really thankful for all the work that you're doing. This is so, so valuable, and particularly at a time on the planet like right now that we're all navigating. And so I really appreciate it.
Thank you so much for having me, Molly. I had such a great time.
Oh, awesome. You've been listening to the Sleep is a Skill podcast, the #1 podcast for people who want to take their sleep skills to the next level. Every Monday, I send out something that I call Molly's Monday Obsessions, containing everything that I'm obsessing over in the world of sleep. Head on over to sleepisaskill.com to sign up.